Hi, this is Dr. Omar Henriquez with Family Spine and Pain Care Institute. Today we're going to talk about spinal cord stimulators. Spinal cord stimulators are things that we use in order to deal or help with pain for patients that have had surgery and continue to have the lower back pain and the sciatica pain, or patients that have tried the epidural injections and the facet injections and ablations and nothing is helping them. Maybe they're not a candidate for surgery. Maybe the surgery is too much for them, for their health and for their age. And so what we do with this is we try to mask pain as much as possible to allow you to go out and go fishing and golfing and playing tennis and doing what it is that you enjoy. What a spinal cord stimulator is two small little wires that we put into the epidural space. And what these wires do is they mask the pain generated from the back to your brain. So the way that pain works is, let's say you have L4-5, L5S1, L4-5 fusion. If the pain generated is coming from the lower back, it will go through the spinal cord into the brain. The brain perceives that particular pain. It's basically telling you, hey, here's some pain, do something about it. Well, we've done something about it already, but you continue with pain. So we need to stop that messaging system. How do we do that? We put these little wires in there, and now as the pain signals up through the spinal cord, these wires change that message to your brain. So your brain is perceiving something different. It's perceiving a massaging sensation, maybe a vibratory sensation, something very calming and smooth. Or now with technology, there's ghost technology, which means that you just won't feel anything at all. You won't feel that pain anymore. And so there's a couple ways of doing this. Number one, there's a couple steps of doing it. Number one is you get to try it out. When we trial it, you get 7 days, 5 to 7 days to actually take this system home. It's just like doing an epidural injection. We put the wires in, we tape everything outside, and you take it home, and you have a representative that calls you on a day-to-day basis to make sure that things are working appropriately. On the 7th day, you come back, I take the tape off, I pull the leads out or the wires out, and then I ask you, did you get greater than 70% relief? Did it help you? If you tell me I felt great, I had 90, 100% relief, and I was able to do more, then at that point we would decide to actually implant the system inside of you. Now it's implanted inside of you as two small incisions to go inside, and it stays inside of your body so that you can still, if you like swimming or scuba diving, you could still do that. Now, the only caveat is that the battery has a half-life of 7 to 10 years, which means that every 7 to 10 years, you may have to go ahead and change that battery. But again, it's a very quick procedure. It's an outpatient procedure. Small little incision. They take the battery out. They put the new one in. They suture it, and you're done. If you have any questions or if you want more information about spinal cord stimulators, please contact us at Family Spine and Pain Care Institute. Thank you.